Here is a detailed explanation of daptomycin. Generic name, drug class, drug forms, brand name. Generic name, daptomycin. Drug class, lipopeptide antibiotic, specifically a cyclic lipopeptide. Drug forms, lyophilized powder for reconstitution and IV injection, commonly 350 milligrams or 500 milligrams per vial. Brand names, Cubicin, Cubicin RF, reformulated for longer shelf life. Definition: daptomycin is a parenteral cyclic lipopeptide antibiotic used primarily for treating serious infections caused by gram-positive bacteria. It is particularly effective against resistant organisms like MRSA, methicillin-resistant Staphylococcus aureus, and VRE, vancomycin-resistant enterococci. 3. Mechanism of action. Daptomycin's action is calcium-dependent, requires calcium ions to bind to bacterial membranes. It inserts its lipophilic tail into the bacterial cell membrane. This causes membrane depolarization by creating ion leakage, particularly potassium efflux. As a result, it disrupts essential processes like DNA synthesis, RNA synthesis, protein synthesis. Ultimately, this leads to rapid bacterial cell death. Bactericidal in nature and works concentration dependently. Note, it does not work for pneumonia as it is inactivated by lung surfactant. DAF4, indications, uses. Daptomycin is FDA approved for 1. Complicated skin and skin structure infections, CSSSI, caused by MRSA, MS Streptococcus pyogenes, Streptococcus agalactiae. 2. S. aureus bacteremia, including right-sided infective endocarditis. Off-label uses, under physician guidance, osteomyelitis, bone infection, prosthetic joint infections, vancomycin-resistant enterococcus, VRE infections, left-sided endocarditis select cases. NAF5. Contraindications. Known hypersensitivity to daptomycin or formulation ingredients. Not to be used for pneumonia or pulmonary infections. Drug is inactivated by surfactant in lungs. 6. Before taking this medicine, precautions. Inform your doctor if you have kidney problems, requires dose adjustments, muscle disorders, or history of rhabdomyolysis. Current or recent use of statins, e.g. simvastatin, atorvastatin, which may increase the risk of muscle injury. Allergy to other antibiotics. Pregnancy. Category B. Use only if clearly needed. Breastfeeding. Caution advised. Insufficient human data. Monitoring required. Weekly creatine phosphokinase, CPK levels, muscle enzyme, renal function tests, liver enzymes if prolonged use. 7. How to use. Given only by IV infusion over 30 minutes or IV push over 2 minutes. Administered once daily or every 48 hours if kidney function is poor. It is prepared by reconstituting the powder with sterile water or saline and must be used soon after preparation, varies based on brand. Must be used under healthcare supervision. 8. Dosing information. Adults, complicated skin and soft tissue infections, 4 milligrams per kilogram IV once daily for 7 to 14 days. S. aureus bacteremia, including right-sided endocarditis, 6 milligrams per kilogram once daily for 2 to 6 weeks. Renal impairment. If creatinine clearance CL 30 milliliters per min, give dose every 48 hours instead of daily. Pediatric doses, weight-based, vary by age and condition. 9. Missed dose and overdose. Missed dose. Inform your healthcare provider. If it's close to the next dose, skip the missed dose. Do not double the dose. Overdose. Symptoms: muscle pain, elevated CPK, possible kidney injury. Treatment: no specific antidote. Supportive care. Dialysis does not effectively remove daptomycin. 10. Stop or avoid taking if you develop severe muscle symptoms, pain, weakness, dark urine, you develop respiratory symptoms, eosinophilic pneumonia, signs of an allergic reaction, rash, swelling, difficulty breathing. Lab tests show elevated CPK or renal liver dysfunction. 11. Side effects in detail. Common: injection site pain reactions, headache, dizziness, fever, nausea, vomiting, diarrhea, constipation, rash. Serious: myopathy, rhabdomyolysis, muscle breakdown. Signs: muscle pain, weakness, dark urine, eosinophilic pneumonia. Symptoms: fever, cough, shortness of breath, infiltrates on imaging. Peripheral neuropathy, elevated CPK and liver enzymes, renal dysfunction, allergic reactions, anaphylaxis, angioedema, Stevens-Johnson syndrome, rare. Tire 12, vital information. Do not use for lung infections. Drug is inactivated by surfactant. Monitor CPK weekly during therapy, more often if using statins. Adjust dose in renal impairment. May require liver and kidney monitoring in long-term use. Refrigerate after reconstitution. Cubicin RF has extended stability. Always assess for drug interactions before starting. 13. Other drugs that will affect daptomycin. Increased risk of muscle toxicity when combined with statins, e.g. simvastatin, atorvastatin, rosuvastatin, fibrates, e.g. gemfibrozil, other myotoxic drugs, nephrotoxic drugs, increased renal stress, aminoglycosides, e.g. gentamicin, tobramycin, NSAIDs in high doses, vancomycin, monitor kidney function closely if used together, may increase INR, monitor coagulation parameters if co-administered. Muscle relaxants may have additive neuromuscular effects. Thank you. Have a nice day.